Zen, I'm live, okay, Zen? I'm live. Okay, this is a continuing of the respiratory portion of the NCLEX RN questions. So let's start. Let's start with the first question. The nurse is preparing to suction a client through who has a trach tube. Okay. The nurse should plan to limit suctioning time to a maximum of how long? It says the nurse is suctioning the patient, and how long should the patient suction the patient? Because you know you're not supposed to suction the patient for too long. So what is the number, the amount of time, like the length of time the nurse should suction a patient? I'm going to give you some option, and then you guys can choose the right one. Okay, let me check to see if you can hear me first. Let me put the microphone, see if you can hear me better. Hello, hello. Test the microphone. Okay, can you hear me better now, guys? Okay, I think it's way better now. Okay, let's start over with the first question. Okay, the nurse is preparing to suction a patient who has a trach tube on. And what should be the plan, or what the nurse should plan to limit the suction time? The nurse should plan to limit the suction time to a maximum of what time? Let me give you some options. The first one says 1 minute. Okay. The second one says 5 seconds. Third one, 10 seconds. And then we have 35 seconds. Which one you guys think is the best? Which one you think is the best option, guys? Okay. 3 is the best option, 10 seconds. The reason why you cannot suction the patient, you cannot spend too much time suctioning the patient, is because each time you suction the patient, while you're removing the secretion, you also removing oxygen. So if you don't limit the amount of time you're suctioning the patient will become cyanotic. So you know, cyanosis is a sign of a lack of respiration. It's a lack of oxygenation. So you have to very careful to suction the patient with the recommended time. Okay, let me choose this one. So this is the right question. So let's move on to the next one. Let me add it. Okay. The nurse is assessing the respiratory status of a client who has suffered a fractured rib. The nurse should expect to note which finding. What do you think, guys, the nurse will find in a patient who has fractured rib? I will give you the options, and then you can choose from them, and you'll choose the right one. The first one says slow deep respiration. Do you think the patient will have a slow and deep respiration because of a fracture rib? The second one say rapid deep respiration. Slow deep is like the patient is breathing very slow but deeply. The second one is like a tachypnea, but it's deep. Do you think that's what the patient will do? Or what about the third one? Paradoxical respiration. This is an abnormal respiration also. And the fourth one says pain, especially with inspiration. You know, there's expiration and inspiration, right? So do you think the patient will... Inspiration normally is breathe in. Expiration is when you breathe out. Do you think the patient will have more pain while breathing in or while breathing out? So the answer is 4. It's a pain, especially with inspiration. Each time the patient take a breath, the patient will feel some kind of pain. It will be very painful. So that's the reason number 4 is the correct answer. So we move on. Let's move on to the third one. Third question. A client with a chest injury has suffered Flair Chest. The nurse assessed the client for which most distinctive sign of Flair Chest. Flair Chest is known when you have like mostly your patient with COPD or emphysema. They have the tendency of having a Flair chest is when they have like the chest look like very pronounced, and because of the way they try so hard to breathe, so they have that deformation in the chest. And the question says the client with a Flair chest injury has suffered, and what kind of assessment the nurse will do, and what will be the finding. So the first answer is cyanosis. Do you think a patient who has a Flair chest will be cyanotic? You know, cyanosis is the blue discoloration of the patient. That's a sign of lack of oxygenation. The second answer says hypotension. The third one says paradoxical chest movement. And the fourth one is dyspnea, especially on exhalation. It means each time the patient is trying to take a breath, the patient has dyspnea, which is a low respiration. Okay, let's see. Which one you think, guys, is the answer? The answer is paradoxical chest movement. The movement of the chest will not be symmetrical. It will be abnormal. So let's go for the next one. Okay. The nurse is assessing a client with multiple trauma who is at risk for developing acute respiratory distress syndrome, which is ARDS. The nurse should assess for which earlier sign of acute respiratory distress. The first answer is bilateral wheezy. Do you think a patient who has ARDS will have wheezy? Of course, it's possible, but let's see the other answers. But the thing is, you have to look for the early sign of ARDS. The second one says inspiratory crackles. That means each time the patient take a breath, you will hear crackles, and crackles is a sign of that means there is the secretion in the airway. And the third option is intercostal retraction. Do you think the patient will have intercostal retraction? Or do you think the patient respiration will be increased? It says increase in respiratory rate. What do you think a patient with ARDS will have? The answer is increase in respiratory rate. Each time the patient is trying to breathe out, the respiration will be like an increase, like it's gonna be a little fast. The rate will be like very fast, and you know, if the rate is fast, the patient will not really breathe out the amount of air that should have been going out. That will cause the patient to have what we call in respiratory, we call that air trapping. Because if you don't get enough air out, the rest of the air will stay in the lung. That's what we call air trapping. Next question. The nurse is discussing the techniques of chest physiotherapy and postural drainage. This is a type of respiratory treatment for patient who has secretion and also atelectasis, for example. So the nurse is discussing the technique of chest physiotherapy and postural drainage to a client having expectoration problem because of chronic thick tenacious secretion in the lower airway. The nurse explained that after the client is positioned For postural drainage, the nurse will perform which action to help loosen the secretion? So they would like to know what the nurse will do when doing a postural drainage for the patient just to remove the secretion. They would like to know how the nurse will perform the procedure, and what will be the best action for the nurse to help that's the secretion to get removed. The first one is palpation. Palpation and clubbing. Palpation is clubbing is mostly like you're doing a CPT. You know, CPT is when you put your hand, like, you know, you put in a cuff way like this, and then you tap the patient back. You tap the back, you tap the lung area. That will help the secretion to help you loosen the secretion. So that's the first choice. And then the second one is percussion. Percussion and clubbing. And then the third one is hyperoxygenation and suctioning. Do you think that will facilitate the removal of secretion? Normally, you can hyperoxygenate the patient. Of course, you have to do it before and maybe during and after. Do you think that will facilitate the removal of secretion? And the last option is administer bronchodilator. You know, for a patient who has a lot of secretion, we normally use a bronchodilator to break down the secretion, to loosen the secretion. So do you think is the best option? Not only say to administer bronchodilator and also monitor the peak flow. So what do you think is the best option to facilitate the removal of secretion, to make it loose, something that can make the secretion loose? So the answer is percussion. I have palpation. Where's percussion? Oops, I didn't put percussion. Percussion is the best option. Next one, let's move on. Okay, here's the next one. The nurse is preparing to give a bed bath to an immobilized client with TB, with tuberculosis. The nurse should wear which item when performing this care? What kind of equipment do you guys think the nurse should wear when taking care of a TB patient? What kind of equipment do you guys think the nurse should wear when taking care of a TB patient? Do you think the nurse should wear surgical gloves and mask? Do you think the nurse should use like a glove, the respiratory mask and gown? Okay, let me put the option for you so you can see exactly. You can choose from the answer and get the best one. And then the third one is protective eyewear. Do you think the patient the nurse should wear a goggle to take care of a TB patient? This is a very important question right here. Tuberculosis is a very, very, very important question. You need to know this. And do you think the nurse should wear surgical mask, gown, protective eyewear, which is a goggle? So we should choose the best answer, guys. What equipment do you think the nurse need to take care of a TB patient? You know, for TB patients are airway. So that's a clue. The answer is to take care of a TB patient, the nurse will need to wear N95, what we call respirator. That's what they call particulate respirator. You not only the nurse has to wear N95, the nurse has to wear a gown, and the nurse has to wear gloves. The nurse doesn't have to wear goggle when taking care of a TB patient. The only way you will have to wear goggle is only if only the patient is having some secretion. You know, there are some of the respiratory patients. It's either the patient has a lot of secretion on or off a ventilator. So if you're taking care of a patient like this, it's very important that you wear goggle, because you don't want the droplet to get into your eyes. That's the reason it's good to wear goggle. Okay, but if it's a regular TB patient that is on the floor, like if it's a regular TB patient, you really don't need to wear goggle. Okay, so the answer is 2. Next question. That's a very important in-class question. Okay, next one. A client has experienced pulmonary embolism. The nurse should assess for which symptom, which is most commonly reported. Okay, that one is about a patient who has pulmonary embolism. You know what is embolism? Is when the patient has a blood clot in the lung. You know, this is a life-threatening situation. The patient can have that blood clot. It could be in the lung or brain or the heart and all that. So this one is in the lung because they say pulmonary. Okay, pulmonary is the lung, and then embolism is the blood clot. It's a blood clot. Okay, so what would you do for a patient who has pulmonary embolism? What symptom will you assess for that patient? Let me put the option right here. This is the first option. Heart flushed feeling. Well, the patient has a heart flushed feeling. The second one is sudden chills and fever. That means sudden means something that just happened. The third one is chest pain that occurs suddenly. That means the patient will the patient have a sudden chest pain because of the pulmonary embolism. The last one says dyspnea when deep breathing or broken. Dyspnea when deep breathing or broken. No, or taking, sorry. When deep breathing or taking. That means each time the patient take a deep breath, the patient will have dyspnea. Dyspnea is what we call also SOB, is shortness of breath. Do you think the patient will have shortness of breath when the patient breathe? When you take a very deep breath? The answer will be chest pain that occurs certainly. So with a patient that has a pulmonary embolism, the patient will, when the nurse make an assessment for that patient, this is the symptom the nurse will find. This is a common symptom that mean the nurse, in every patient that has pulmonary embolism, the nurse will find that kind of problem. Chest pain, a sudden, remember that word, sudden chest pain. That means acute chest pain. You can say that too. Acute chest pain. That means just happened. It's not chronic, it's acute. We go on to for the next question. Okay, a client with acquired immunodeficiency syndrome, AIDS, has histoplasmosis. The nurse should assess the client for which expected finding. What do you guys think you will find in a patient who has immunodeficiency syndrome, AIDS, and that patient also has histoplasmosis? What do you guys think will be the answer? Let me give you the options. Normally, before I add the answers, I want to tell you histoplasmosis is some kind of fungal infection. The first option is dyspnea. Do you think the patient will have dyspnea? Do you think that patient will have headache? And do you think that patient will have weight gain? Or do you think the patient will have hypothermia? The answer is dyspnea. Okay? The infection begins as a respiratory infection and can progress to disseminated infection that can cause infection. And then the common symptom that patient will have mostly will be fever, dyspnea, cough, weight loss. You see, weight loss, not weight gain. Let's move on to the next question. The nurse is giving discharge instructions to a client with pulmonary sarcoidosis. The nurse concludes that the client understands the information if the client indicates to report which early sign of exacerbation. I'm going to put the options right here for you. The first one is fever. The second one will be fatigue. The third one will be weight loss. And then shortness of breath. So the answer is 4, shortness of breath. Dry cough and dyspnea are typical early manifestation of pulmonary sarcoidosis. And then later on you will have night sweats, fever, weight loss, and skin nodules. Let's move on to the next one. Okay. An oxygen delivery system is prescribed for a client with chronic obstructive pulmonary disease to deliver a precise oxygen concentration. Which oxygen delivery system would the nurse anticipate to the prescribed patient to be prescribed? So what they tell you here, the nurse is taking care of a COPD patient, chronic obstructive pulmonary disease patient. The nurse has to give oxygen to the patient, and they would like first you have to give a specific amount of oxygen to that patient. So they would like to know what kind of delivery system, what kind of equipment will the nurse use to give that treatment. The first option is a face tent. The face tent is like it's a kind of oxygen device that covers the entire, the entire face is covered on it. You know, the second one is a Venturi. The Venturi mask has some kind of way of controlling the amount of oxygen you want to give to the patient. ISO mask. The ISO mask is mostly that one you use to give like a treatment. And then we have the tracheostomy collar. That kind of mask is that one you use for patient who has the trach. Okay? So which one you guys think will be the best answer right here? If you want to give oxygen to a COPD patient and you have to give a specific amount of oxygen to the patient, which one you guys think will be the best? A face tent, you cannot deliver a specific amount of oxygen to the patient. Like you can regulate it to the wall, like to the oxygen regulator. But there's one of them that is totally different. Oops, face tent. I forgot to put Venturi mask. Venturi mask. Here you go. This is not the right one. Let me get it for you guys. Venturi mask. Venturi mask is also what we call Veni mask. Here you go. Venturi mask is the only mask you can prescribe a certain amount, a specific amount of oxygenation to the patient. Okay? So the answer is Venturi mask. That's the only one. If they tell you you have to give a precise, like a specific amount of oxygen to the patient, and it's the way you regulate it is exactly what the patient will receive, Venturi mask is your best option. And it's very important for you to know about Venturi mask, guys. You can Google it. You can go look for more about it. For COPD, it's good to know about oxygenation because you will have question about that. COPD is one of the subject that always gonna be there. So we're going to move on to the next question. The nurse is instructing a hospitalized client with a diagnosis of emphysema. about measures that will enhance, that will help the effectiveness of breathing during dyspneic episode. That means while the patient has some kind of, when the patient have some episode of dyspnea, that means shortness of breath, they want the nurse to instruct the patient of some measures, some way to cope with that kind of problem. And that patient is a patient that has emphysema. You know, emphysema is a type of COPD. Sometimes they might not tell you if COPD, they might tell you emphysema. So it's very important to know about the different type of COPD patient. Okay, so they want to know which position should the nurse instruct the patient to assume. What position you want the patient to take to get in order for to promote the effectiveness of breathing. So that means the position has to do, is very important to decrease respiration, to help with the problem with the respiration. So I'm gonna give you the position and then you will choose from. The first one is sitting up in bed. Will you ask the patient who has emphysema, who has obstructive disease, to sit straight in the bed to help with the respiration? Or will you ask the patient to sit to side lying in the bed? And the third option is sitting in a recliner. Will you ask the patient to sit in a recliner? The last one is sitting on the side of the bed and leaning on the overhead table. So this is, the last one is also a position that they will ask you for patients who are doing a chest tube, patient that are being having a removal of air. Sometimes they will ask you that question about the patient. So for a patient with emphysema, which one you think you will be the best option? This is the best answer is number 4. Not only that answer apply for patient with emphysema, and guys, please remember that question. You will see it. This is a very important question. That's mostly patient with COPD, because those patients are mostly life-threatened. So it's very important that you know about COPD, emphysema, and all that. So this is one of, you will encounter that answer not only for patient who has emphysema, COPD, and you will also find this for chest tube, for tomosynthesis. Yeah, they will ask you what will be the best position for the patient to take that will increase the respiration, that will facilitate the respiration. So this is one of them. Let's move on to the next one. Okay, the nurse performs an admission assessment on a client with diagnosis of tuberculosis. The nurse should check the result of which diagnostic test that will confirm this diagnosis. Okay, what they're telling us right here is the nurse will be taking care of a patient who has TB. And they want to know what kind of test will the nurse do for a patient with TB that will confirm that the patient really has it? What kind of test do you think will be good for a patient that has tuberculosis? And not only they don't only ask you what kind of test that will show, but that test will confirm. They have other tests to do, but there is one test that will confirm that the patient has TB. The first option is chest x-ray. Chest x-ray is when you do they're gonna send the patient to the radiology, and then they will look to see through the x-ray. It's like an imaging. They will see the lung, and then they will look for the findings and see what, if it has to do with TB. The next one is bronchoscopy. Do you think they need to do a bronchoscopy for a patient who has TB to confirm that the patient has TB? Bronchoscopy is when they have to put like a little camera to the patient lung. They'll go into the upper airway, and then they will try to look for something that has to do with TB. That's not only for TB, but for other patients. But do you think this is the best option? I don't know yet. Let's see. Let's move on to the third one. The third one is sputum culture. Sputum culture is when you ask the patient to spit in a tube, or if the patient cannot do it, you will have to suction the patient to get the sputum, and then you will put it in a suction cup to send to the lab. And you have a certain time to do it, mostly early in the morning. Do you think this is the best option? This is one of the tests for TB, but do you think it's the best option? And the last option is tuberculin skin test. Tuberculin skin test, most of us, we have to do that test, even you have TB or not. And then you have to go after a certain time to go back to the lab, and then to see if there's any sign of TB. But after you do that test, you still have other tests to do. All these tests are part of the TB assessment, but there's one that you will do to confirm. Sputum culture is the answer. Okay. Not only they will do the sputum culture early in the morning, and then you have a certain amount of culture to do in order to find the sign of TB. It has to be positive in order for the patient to have TB. Let's move on to the next question. Very important question, guys. Okay, here we have our next question. Okay, the low pressure alarm sounds on a ventilator. The nurse assesses the client and then attempts to determine the cause of the alarm. If unsuccessful in determining on finding the cause of the alarm, the nurse should take what initial action? Okay, let's translate it to a way that we can all understand. The nurse is taking care of a patient who is on a ventilator. Okay? And then the nurse heard the alarm on the ventilator. Normally that kind of alarm she heard we call it low pressure alarm. We have low pressure alarm and we have high pressure alarm. Each of them means something different. That's very important that you know about the alarm sound of the ventilator, guys. before you take your NCLEX exam. So since the alarm is the low pressure alarm that the nurse heard, the nurse she might not know exactly what to do. In case you don't know what to do, there's a different answer for that. When the nurse assesses the client, the nurse heard the alarm, but she doesn't know exactly what to do next. So what she does, she assesses the client to see if there's any problem with the client, with the patient. If you hear the alarm, the first thing you have to do when you get to the room, you have to go straight to the patient. We have the equipment and we have the patient. Don't ever go to the equipment first. You have to go to the patient first. And then you will assess the patient. In that case, the nurse couldn't find the problem. And then they give us different options to see what would you do if you were the nurse. The first one says administer oxygen. You hear the alarm and then they say administer oxygen. You might hear the low alarm, and then when you look in the monitor, you see the patient, the oxygenation and saturation are perfect. So that might not be the answer. The next one is check the client vital sign. They want you to check the client vital sign while you're doing the assessment to see if there's any problem. And the third one is ventilate the patient manually. Here, ventilate the patient manually, that means bag the patient. You have to take an embu bag and then you have to bag the patient because you don't know what to do. If you're taking care of a patient who is on a ventilator and then you hear a low pressure or high pressure alarm, you don't know exactly what you have to do. There's one option right there that is the best one. So the best option will be, the best option is to ventilate the patient. Because you don't know what to do, even you knew what to do because you are one person in the room with the patient. And everything that has to do with the ventilator, you know who has to take care of that is the respiratory. Okay? You're not gonna go to the ventilator trying to troubleshoot the ventilator. Not only you can cause a bigger problem, and respiratory therapy will not be happy about that. Okay, guys? The first thing, if at any time you're taking care of a ventilator patient and you hear low alarm, you have to bag the patient. Remove, if it's a ET tube, remove the tube and then connect the embu bag, connect it to the oxygen and all that, bag the patient, and then ask somebody to call respiratory for you. If there's no one, find a way while you're bagging the patient, and then if you have your phone, you can, while you're bagging the patient, and then you have to call respiratory. And then there's a button also. If you don't have your phone with you, you can press the button and then someone will come to find out what's going on, and then you can tell them to call respiratory for you. Never try to troubleshoot the ventilator because you were not trained for that. Let respiratory therapy take care of it. And also what you need to know, even you're not gonna take care of the ventilator, you still need to know what a low alarm and low pressure mean. And at any time you hear a low alarm, it's either there's a disconnection, you hear me? It might be a disconnection. It's either the tube that connect to the patient, it might be disconnected from the patient, or it might be from the ventilator, you see? And it also can be a leak. If there's a leak in the system, for example, the leak can be in the circuit, the tube, it can be in the circuit, it can be in the ET tube, and also the leak might be through the patient mouth or the trach, maybe it's loose. If the ET tube or the trach is Xander, I'm live, please. If the ET tube or the trach is loose or disconnected, you will have a leak. And you can also have a low pressure alarm if there's a disconnection in the somewhere. If the ventilator is disconnected, if there's a disconnection somewhere in the power outlet, something that is connected to the ventilator is disconnected, that will also cause a low pressure alarm. Okay, and sometimes a low pressure alarm can be a good thing. For example, you have a patient that has atelectasis or have an obstruction, something going on in the lung, and then the low alarm can be a sign of improvement in the lung. Let's say the lung was very stiff and then was like full of stuff, and then the lung is improving. That also can cause a low pressure alarm. But since you are not a respiratory therapist, you are not going to troubleshoot all this stuff. You will let respiratory therapists find a problem, while you are bagging the patient. You should never leave the patient. You have to stay there and bag the patient while the respiratory is doing its own thing. Okay? So the best answer is ventilate the patient manually. That means take your embo bag and start bagging the patient. Bag the patient, okay? That's what we call ventilate manually. You bagging the patient. Okay, next one. The nurse is teaching a client with emphysema about position that help breathing during dyspnea, during a dyspnea period, okay? The nurse instructs the client to avoid which position that could aggravate the breathing. So the nurse is taking care of a patient. That patient is an emphysema patient. That means that patient has an obstructive respiratory problem. So the nurse wants the patient to have to sit or to lay down or to stay in the best position that will help the patient to breathe better. But there's one position, if the patient take, the patient will aggravate the problem. So let me put the option here so you can choose the best one. The first one says sit up and leaning on the table. You remember we had that one. You know what it does for a patient with emphysema, right?
Oh, nice.
And the second one says standing and leaning against a wall. Are you going to ask a patient who has emphysema, who's trying to breathe, to stand up and lean against a wall? That way it will be able to breathe better? Or are you going to ask the patient to sit up with sitting up with elbow resting on the knees? Do you think that's one of the options? Do you think that's the best one? Let me give you the last one. The last one says lying on the back and in a low faller position. We have high faller, we have semi-faller, and we have low faller. So the high faller is more up. The semi-faller is more like you are about to lean down, but you don't. You stay between 35 to 45 degree, and then low faller is even lower than 35 degree. So which one you think is the best option? Which one will you ask the patient? Which position? Are you going to ask the patient to sit on a table and lean? Are you going to ask the patient to stand up? Are you going to ask the patient to sit up with elbow resting? Or are you going to ask the patient to lay down very low? So the best answer is I'm surprised the answer is lying on the back in a pillow in a low Fowler position. Okay, you know, this is a very tricky question, guys. The thing is, after we went over the question, and then when we go through each answer, in our brain, all the answers are good. The only one that is bad is this one. But the thing is, they don't ask you for what is best, what is good. They ask for something that is bad the patient is doing that can cause the patient to get worse. And when we're so deep, we are reading the question, we're deeply in the question and the answers, we forget that we have to look for something that has to make it worse. You see what I mean? You're gonna have a lot of questions like this. So what will make the patient feel worse is number 4. If the patient is laying down, of course the patient will not be able to breathe. The patient will have difficulty breathing. So the best one, normally the very best one is number 1. Number 2 can help. Number 3 also can help. You use the patient is sitting up and then resting the elbow on the knee. So this is also one of the good ones. But this one right here, number 4, is the worst. Let me see how long I've been live. Average watch time. Okay. Okay, let's do one more. We're going to do one more question, guys, and then we will come back after, okay? Okay, here's the last one.
Oops, sorry.
A client is returned to the nursing unit after thoracic surgery with chest tube in place. During the first few hours post-operatively, what type of drainage should the nurse expect? Okay, what they mean is the nurse is receiving a patient that is a post-op patient that had a surgery, a thoracic surgery. That means, you know, the thoracic is the cage that is protecting the lung. So the nurse, after that kind of surgery mostly can be done if the patient has let's say it can be a pneumothorax, hemothorax, tension pneumothorax, like something going on in the lung. So they had to do a thoracic surgery for the patient. So now after the surgery, the patient is going back to recovery, for example, and then you are the nurse receiving that patient. The patient has a chest tube in place. The chest tube is a very important thing you need to know. You really need to know. Mostly you have to know about the water level and all that. And so the patient has a chest tube in place. Okay? A few hours after, they want to know what kind of drainage will you see through the chest tube coming out from the patient. So the first option is cirrhosis. You know, we have a cirrhosis might be like it depends on the color. It's not bloody. It has blood on it, but it's not like a bright red. And then you're gonna have bloody, which is like a bright red coming out. You have serosanguinous. And then the last one is bloody with a frequent small clot. Which one you think you will see in a patient who has a chest tube in place that just coming from the surgery? which one you think is the best option, and which one you think if you see it you have to act really quick. So let's say the best option is bloody. Xander? So during the first hours of a post-op patient, in a post-op patient, you will find that kind of you will find that this is an expecting outcome for a patient that just coming from the surgery for a thoracic surgery, for example. They say in the first few hours after surgery, the drainage from the chest tube is bloody. In the first few hours. After several hours, it becomes serosanguinous. The client that means it become a little light. You will see it's gonna have blood, but it's lighter. It's not gonna be that bright. And the client should not experience frequent clotting. You should not see any clot. Like, the clot is that very like a thick piece of blood. You should never see that. This is a sign of hemorrhage. You should never. If you see that, it's an emergency situation. Proper chest tube function should allow for drainage of the blood before it changes to clot. Okay, no clot should be. You should never see clot. If you see clot, you need to call the doctor. Okay, guys, so this is all for today. I will see you back maybe tomorrow. I will try to set a schedule. I used to go live every day, but now I'll come with a schedule for you guys. And if it's your first time here, don't forget to subscribe. After you subscribe, you will see a bell notification showing. You need to click on the bell. That's the only way for you to get all the notification. That's the only way for you to know when I'm live, and so we can continue to work together. Okay, guys? Thank you for being here, and see you. And please, if you're here, don't forget to leave me a comment. That will encourage me. At least I know who's here with me. Okay, guys? Thank you. And don't forget to like the video also. Each time you like the video, that will also help the algorithm and help other people to find the video. Thank you guys for being here. Ciao.